All right. The first question here says bicarbonate system is an important buffer system because option A has pKa close to physiologic pH. Option B, carbon dioxide can be exchanged in lungs and bicarbonate excreted in kidneys. Option C, bicarbonate occurs in such large amounts. And option D, regulated in the lung and the liver. So what's the answer, guys? Make your choice. If you look at the question very well, one stands out. Um, Basically, bicarbonate is a combination of carbon dioxide and water. Okay, so uh, um, or rather, carbon dioxide and water will form carbonic acid. Through a reversible reaction, carbonic acid can break down into hydrogen, a single hydrogen ion and bicarbonate. Okay, so you can see that if you have bicarbonate and hydrogen ion on one side, eventually it will turn to carbon dioxide and water. So with that in mind, it means you can regulate it from either side. The carbon dioxide can be regulated through the lungs, excretion of carbon dioxide or retention of carbon dioxide as the case may be, and the bicarbonate can be modulated through the kidneys through excretion or reabsorption as the case may be. So that tells you that option B is the answer for this question. That's the option that makes the most sense. I'll give you a lot of chemistry questions there. During infusion of an acidic solution, HCl, which contributes most to buffering, phosphate buffer, intracellular buffer, bicarbonate buffer, none of the above. Yes, of course, it's the bicarbonate. Based on what I just explained, bicarbonate is a base or alkaline, and the acid that they mentioned, hydrochloric acid, is an acid, right? So for them to neutralize, which you want in the body, for you to maintain homeostasis, you have to neutralize the acid that is being introduced into the system. And you have to use an alkali, which is the bicarbonate, to neutralize it. So what bicarbonate will do is that it will bring up its own ion and take out the hydrogen ion from the hydrochloric acid and then neutralize it to form carbonic acid, which will further break down into water and carbon dioxide. Carbon dioxide can be excreted from the lungs. Okay, so that's basically it. Okay, this one is about anion gap. Normal anion gap, um, metabolic acidosis. There are two types of metabolic acidosis. There's normal anion gap, and there is high anion gap. Okay, so which of them amongst the option will cause normal anion gap metabolic acidosis? Let's attempt the question now so that we move. One of you can go to the group and remind others to come. Where is Dr. Ayo? Dr. Harrison, kindly remind others to come along. Okay. Um,
I'm just even joining now, sir.
okay.
Yes,
Well done.
yes, yes, yes.
So let's attempt the question. So, like I said, metabolic acidosis has two types. Okay. So there's normal anion gap, and there is what? High anion gap. Let me start with high anion gap. High anion gap should be easier to remember because it has to do with any external substances, okay, that will um, increase the anions in the blood. Please mute your mic. Like any substance at all that will increase the anions in the blood. You know, anion gap is when you do the difference between summation of the cations and summation of the anions. Okay, if you do the difference between them, that's that anion gap. So that anion gap, when you get that difference is more than 12, it's assumed that there's an extra anion that was introduced into the body. That's why you now have excessive anion gap, right? So um, what does that imply? Things like in diabetics, okay, let's say someone is having diabetic ketoacidosis. When they have ketones, that can increase the anion gap. Even some drugs too can increase the anion gap. So basically, you are looking at anything at all that is an anion that is in the system. Okay, so but normal anion gap usually is like you're getting a metabolic acidosis, but the person is not getting acid being introduced. Okay, essentially what is happening is that you are losing alkaline, and the alkaline that is being lost in this case is bicarbonate. So if there's any means through which bicarbonate is being lost, it will lead to normal anion gap metabolic acidosis. Like all these things that are listed there now, intestinal drainage, person is going to be losing bicarbonate. Remember that bicarbonate is part of the substances that are released by the pancreatic juice. Okay, so it will be lost in diarrhea. It will be lost. Okay, in pancreatic fistula, it will be lost. So that's basically the idea behind the question. So I want us to go to air body so that you see the full list of the causes of um, different types of metabolic acidosis. Tabulate the types of metabolic acidosis with their causes, with lists of their causes. No, well, this is just like a list of the causes, but I want um, classify into high anion gap and normal anion gap, MA. So basically, this table will show you. So in high anion gap metabolic acidosis, remember that anion gap, anything that is above 12 millimoles per liter is already elevated. So you find that in DKA, in lactic acidosis, ingestion of toxic substances, renal failure, sepsis, so the severe one. So the normal one, you can also find normal one in renal tubular acidosis, gastrointestinal loss, which is what the question was testing, gastrointestinal loss of bicarbonate, and excessive injection of chloride or ammonium chloride. So another name for this normal anion gap is hyperchloremic metabolic acidosis. So mineralocorticoid deficiency. So things like that. I wanted you to see. If you want to learn the theory, you can read more about it. So other toxic substances like salicylates, as like aspirin, which is salicylate, ethylene glycol, the urea from renal failure, okay, and some bacteria from sepsis, severe sepsis, can all increase. Then ketones, lactates, uh, toxic substances like that. All right. This one is giveaway now. Just a follow up based on what we just discussed. Examples of high anion gap metabolic acidosis. Please don't move anything. Examples of high anion gap metabolic acidosis include all except DKA, lactic acidosis, pancreatic fistula, end stage renal failure. Just any disease that brings in extra um, anions that are not expected to be in the body from urea in the uremia of renal disease, lactate in lactic acidosis, ketones in DKA, and also the glucose itself. All these things cause high anion gap. But pancreatic fistula will cause normal anion gap because there's loss of bicarbonate through the tracts. Let's take a look at this question. A young adult was profusely vomiting and found to be dehydrated. Uh, which is most likely to be seen? Compensatory respiratory alkalosis, metabolic acidosis, metabolic alkalosis, mixed acid base disorders. When a patient is vomiting, what's going on? What are they losing? The way when that you know that when a patient is having diarrhea, they are losing bicarbonate. So when a patient is vomiting, what are they losing? You have to learn how to reason these things out. You don't cram anything. What's the main substance that is being produced that in the by the stomach that helps digestion of food in the stomach?
It's HCl. The patient is losing HCl when they vomit.
Yes, they are losing HCl. So if they are losing HCl, what does that imply? If you lose acid, what will now happen?
We have alkalosis, metabolic
Yeah,
alkalosis.
yeah. It's just balance of life. There needs to be homeostasis, which means there's maintenance of standard normal environment. Okay. So if it tilts to either way, something happens. So for you to have an alkalosis, is either you are adding extra alkali or you are losing acid. For you to have an acidosis, it's either you are adding extra acid or you are losing base. So basically, so it's a metabolic alkalosis. So high anion gap metabolic acidosis with increased osmolar gap include all except ethanol, isopropyl alcohol, ethylene glycol, methanol, propylene glycol. So the answer is isopropyl alcohol. Occupational diseases include all except asbestosis, pneumoconiosis, hearing loss, all of the above. Of course, it's option D. That makes the most sense. Everything there can occur based on someone's occupation. Okay, giveaway from yesterday. Okay, a clinical scenario. Uh, you see a patient with yellow-green color visual defects and arrhythmias. He has overdosed on a certain unknown medication. How do you manage him? Option A, flumazenil, sodium bicarbonate, digibind, glucagon, pralidoxime. So your first instinct should be to know which substance or medication will cause this and this at the same time. Okay. So which substance is that? Let's start from there. Dr. Joaira, which substance? Dr. Sam and Hilebo. Yes. It's
It's the
digoxin.
yeah.
Yeah, and the antidote for digoxin is digibind. So digibind, from the as the name implies, basically chelates the drugs in, binds it, and removes it from the system through excretion. What is flumazenil used for? Is an antidote for what? What about praliloxime, glucagon?
Flumazenil is for the diazepams.
Yes, it's used for benzodiazepines, not just diazepam. For
Oh,
benzodiazepines. Okay, so um, she now benz the rain, so it's used for
pralidoxime. I think
benz
it's phosphate, organophosphate poisoning or something
poisoning.
like that.
Yeah, also called 2-palm. Okay, glucagon unko.
Hypoglycemia.
Yeah, you can use it in hypoglycemia.
Okay, that could
But
be excess.
there's still a substance that you use it particularly for, like beta blockers, when there is overdose with beta blockers. So you need to know the common substances and their antidotes. Um, which other one can I think of now? There are a lot of substances. Okay, let me look for them. So let's ask everybody to list the substances and their antidotes. Lists common substances stroke medications table. So yeah, acetaminophen, that's paracetamol. N-acetylcysteine. N-acetylcysteine. Okay, very important for paracetamol poisoning, also known as acetaminophen. Then for aspirin, they present with tinnitus, ringing in the ear. So once you see any question where they are talking about tinnitus, ringing in the air, substance like that, it's most likely aspirin. Activated charcoal and sodium bicarbonate. Okay, remember that aspirin is an acidic medication. That's why it's called acetyl salicylic acid. So you use sodium bicarbonate to neutralize the metabolic acidosis that will be created by aspirin. And remember that it's a high anion gap metabolic acidosis, like we mentioned earlier. So it will be neutralized with sodium bicarbonate and also activated charcoal. Activated charcoal is non-specific, okay, for anything at all. It can be used for almost all substances. Basically, you are using it to take up the substance from the GI, okay, to stop further absorption of the substance, but it doesn't affect the substance that has already gone into the bloodstream. So you need to neutralize those ones by their own specific antidote. So benzodiazepines, like we mentioned, flumazenil, it's a sedative, so you expect the symptoms to be lack of sedation, respiratory depression, and confusion, maybe even coma, right? Then cocaine, uh, Cocaine, they use okay, they use benzocaine and lidocaine, things like that. Where is this other drug? Opioids, yeah, very important. Naloxone is used for opioids. So you see a patient, they present with respiratory depression after having taken something. And apart from respiratory depression, if you check their pupils, it will be pinpoint pupils. Okay, that gives you an idea that it's opioid overdose. So you use naloxone to neutralize it. Which other thing? Okay, digifab or digibind or digoxin specific and FAB fragments. Okay, that's for digoxin. Um, which other common one is here? Okay, so yeah, these are the common medications. And of course, the organophosphate poisoning is 2-pan. Metabolic acidosis is characterized by option A, increased hydrogen ions intracellularly, B, increased pH, normal bicarbonate levels, all of the above. There's a simple paradox that you need to always remember. When so once you have this in mind that pH and hydrogen ions are in two opposite directions, um, that gives you a fairly good idea of most pH related questions. So it leads to both intracellular and extracellular increase in hydrogen ions. Um, so leading to a decrease in the blood's pH, which is acidosis. So it's either there is decreased bicarbonate levels, okay, every acid-base imbalance also has a counter, okay, basically a system that is trying to balance it up. Alkalosis can lead to the following, except high pH, neurons less excitable, numbness, muscle twitching. So alkalosis can cause just means that there is a high pH. Um, Typically makes the neurons more excitable. So the high pH excites the tissues, not less excitable. So that's why it's the wrong answer. The other options are also correct. If you remember your excitable tissues. This question is about hyperventilation. Can result to respiratory alkalosis, respiratory acidosis, metabolic alkalosis, metabolic acidosis. Which one is it? First of all, the first thing, if the issue is coming from the lung, okay, that means it's a respiratory problem. So the acid base balance will be a respiratory something. It can be a respiratory acidosis or a respiratory alkalosis. If the issue is coming from like other parts of the body, including the kidneys, the GI, things like that, then it means it's most likely a metabolic issue, not a respiratory issue, right? So that gives you an idea. Okay, is it a respiratory problem or is it a metabolic problem? So when you now make that conclusion, you now ask yourself, will it be an acidosis or will it be an alkalosis? So that's the way to go about it. So in hyperventilation, what happens? If you are breathing means you are taking in more carbon dioxide than required. Without letting the previous one exit, you'll be taking in more. Okay, so when that occurs, many of the carbon dioxide will now be absorbed through the normal gaseous exchange at the alveoli. And when it gets into the bloodstream, what does it do? It combines with water to form carbonic acid. Carbonic acid will now cleave, okay, and release hydrogen ion and bicarbonate. Okay, so the bicarbonate will now lead to alkalosis essentially. So it's a respiratory alkalosis that you have. In which situation do you expect to have hyperventilation? Is a feature of which disease? There's one prominent disease. It's a feature of many lung diseases anyway, like dyspnea. But that word hyperventilation, there's a condition that is associated with in psychiatry. What is it called? You guys are not reading, or not heard of panic attacks and hyperventilation. So when you see a patient that is having panic attacks, what you should do is to give them a paper bag. Okay, so they blow into the paper bag. That process of blowing into the paper bag is to um, help them to retain some of the air. Shallow breathing or pneumonia can lead to metabolic alkalosis, respiratory alkalosis, metabolic acidosis, respiratory acidosis. Acidosis can lead to the following, except that one is a giveaway question. I'm not going to answer it. So, which of the following has the greatest effect on the ability of the blood to transport oxygen? Option A, capacity of the blood to dissolve oxygen, amount of hemoglobin in the blood, pH of plasma, carbon dioxide content of red blood cells, temperature of the blood. The amount of hemoglobin in the blood, okay, has the greatest effect on the ability of red blood cells to transmit oxygen. So every factor there is actually important. Carbon dioxide, pH, temperature. Okay. So, but the amount of hemoglobin in the blood will be the major determinant. So as I was saying, amount of hemoglobin in the blood is the major determinant of this. So there's something called the oxyhemoglobin dissociation curve. Okay, and there are two major concepts that are being tested. So there's a right shift and there's a left shift. Right shift, I think of it as the right thing for the body. Okay, and the right thing for the body is that the body should, the cells and the tissues in the body should receive oxygen and nutrients, and that's the essence of blood. Blood takes nutrient, oxygen from the lungs to all the parts of the body, and blood also takes nutrients from the GI all over the body as well. Okay, so and these things are going to get to the cells, the cellular level, which is where they are required. to be utilized for energy production, energy storage, okay, and keeping you um, the way you are, right? So for hemoglobin that is carrying oxygen, when it gets to the tissues, there should be some hypoxia and relative absence of nutrients in those tissues or cells that will make it to now release the oxygen. Okay, so what are those factors that are usually there in the cells at the cellular level or the tissue level? You will have um, low pH, which is acidic. You will have high temp. You need temperature, you need energy, and temperature is part of it because it's produced in the process of burning glucose and burning glycolysis, right? So temperature increased. Um, what else? Hypoxia. So there's relative low oxygen there and high carbon dioxide at those tissue level that will now make the oxygen carrying hemoglobin in the red blood cells to release the oxygen it is carrying. So that's the right shift where you have high temperature, low pH, high hydrogen ions. Um, what else? Uh, Low oxygen and high carbon dioxide. So this is just the way you think about it. The opposite occurs in the um, left shift. Because definitely you get questions that will test you on this oxyhemoglobin dissociator curve. Let's look at this question. Trying to determine the main functions of motor neurons, of respiratory control neurons, send out regular bursts of impulses to expiratory muscles during quiet respiration, are unaffected by stimulation of pain receptors, are located in the pons, send out regular bursts of impulses to inspiratory muscles during quiet respiration. So which one do you think it should be? There's some things that you can test on yourself. Between inspiration and expiration, which one requires energy from the body? And which one is passive? Which one is active and which one is passive?
Inspiration is active, expiration is passive during quiet respiration, but during exercise, expiration becomes active.
You are echoing. Why are you echoing? Okay. Okay, you're using two devices or something. Yeah, inspiration is active, while expiration is passive, especially during quiet respiration. Because when you breathe in, you need pressure to breathe in, but to breathe out is just um, normal recoil of the ribs and the lungs that will make you breathe out. So it's that those inspiratory muscles who are doing active contraction that require that regular bursts of impulses. Okay. So it's a two-step multi-factor authentication question. The following physiologic events that occur in vivo are listed in random order. Okay. So what's the usual sequence of events? They ask. They now give options based on that. Do your calculus and tell me the answer. Okay. After the discussion, you can um, read up that topic so that you get acquainted with it. Correct answer. Okay, let's look at this one.